Okay, guys, while you're working in the UK, you need to know about what are the options of conception for the homosexuals because homosexual couples and living with a homosexual partner is legal in the UK. So you may find the people who are coming to you and asking about the options. This is one of the common scenario that you might have heard or you may see in your exam, where you see a lesbian couple has come to you or one of them has come to you and they wanted to know about what their options are. And talking about their options, we need to just first of all identify if they have any understanding about their options. They might have heard from someone, they might have read on the internet, or they might have Googled. So find out if they have any understanding, if they know about any of them. And if they don't know, then we can always, by all means, explain to them. There are a few options that we can mention. These are donor insemination, co-parenting, adoption, surrogacy, trans, and non-binary parents. Donor insemination is essentially is an option where one of the couple member, one of the couple partner want to actually give a birth to a child, and they want to get the sperm somehow. There's an option for them. Co-parenting is, in summary, it is an arrangement between two different couples where one male and female couple have their own real child and they want to share the responsibility, legal responsibility of upbringing the child with a lesbian couple. That's a co-parenting. Another option is adoption, where one real family or a real couple can share the responsibility, can offer their child to a lesbian. However, it limits the rights, the legal rights. After adoption, the lesbian couple will have more legal right, although they are not actual parents. Whereas the actual parents will still have the legal rights, but with the limitations. And then is the option of surrogacy, where this is an option for those who actually want a child from their own genes. However, they do not want to give a birth. So in that case, they can use their eggs and give birth through a borrowed mom, which is called the surrogate, and who will carry the child in their womb till the child is delivered, and after that they can just uh, disappear. And the next option, it is mainly for the transgenders and non-binary parents. So let's talk about them one by one. Donor insemination, as I mentioned, it is where one of the partner of the couple, lesbian couple, wants to give a birth to the child and using their own eggs in their own womb, but they need the sperm. So how they can get the sperm? They can go to the fertility clinic where they can get the sperm inseminated. There are a few options about the clinic. There are licensed fertility clinic as well as non-licensed fertility clinic. Licensed are the clinic where they have sperm banks and they store the sperms after checking all the STIs and genetic disorders. So they keep a store of the clean sperms that can be borrowed, that can be taken by one of the partner from the lesbian whoever wants to be mom. And now talking about their legal status, who will be mom and who will be dad, whether or not both of them will have the equal right on the child depends on their legal status. If they are in civil partnership or they are married at the time of conception, both of them will be equally responsible and they will have the equal legal rights. If they're not married or if they're not in civil partnership at the time of conception, they can choose to fill a form at the time of delivery and will be able to still get their rights. However, these two options apply in cases where they go to the licensed clinic. In cases if they want to go to the private clinic or non-licensed clinic, they may still um, go ahead with the donor insemination. However, uh, only the mom who carries a child in their womb will be the legal mother of the child. However, the other partner from the couple will not have any right. They might need to apply later on for the adoption. It is all funded. NHS normally does not provide any funding for donor insemination. And if someone needs any help and they have uh, paid at least for 6 times, then NHS can provide the funding in those cases. The next option is co-parenting. It is simple, where two couples they meet up, they make the arrangement of sharing the responsibilities, and they have their own legal rights. Adoption, LGBT couples in the UK, they can adopt as well as they can foster a child together. Surrogacy, this is an option where a couple from the homosexuals, especially the lesbians, they want to use their eggs, but they do not want to deliver a child. So in that case, they need to find a surrogate mother who is ready and who is happy to keep the embryo and the child in the womb for the period of time until the child is delivered. And once the child is delivered, the surrogate mother has no relation. She will go away, she will disappear, and both the partners, if they are civil partners at the time of this arrangement, they both will have the equal right. Otherwise, whoever uses the egg will have the right on the child. It is expensive because they have to pay to the surrogate mother, and it is quite legal in the UK. The next option is for the transgenders and non-binary parents. Transgenders, essentially, they cannot use the sperms or the eggs. However, they have the right to adopt a child, or they can share upbringing of the child legally and share the fostering of a child. So these are the few options that can be used while in the UK for the LGBT, for the lesbians and transgenders. Whenever you come across any patient, anyone who wants to know about those options, they are, most of them are all paid. However, there are services who can help them, provide them the right information, initial information, and ask them to think about them and come back to you whenever they have decided which one is the most suitable for them. And then you can put them through to the right clinic and the right services.